Hello, everybody. Suzanne Kellner-Zinck, Donnie Vision's hypnosis. I'm here to answer a really important question that I get from too many people on Quora, as far as I am concerned, looking for competent mental health providers. Because too many of them have employed folks, and they find, they might learn a few different things that can help them out, but they don't feel healed. They don't feel like their lives are moving forward. And basically, in too many cases, they feel like they're going over and over the same crap and never getting anywhere in their therapy sessions. And I've heard the same thing from people on Alignable, who are supposedly therapists themselves looking for a therapist, who aren't happy with the people. In one case, I was talking to a woman just yesterday who said that her therapist is not holding her accountable. She just validates everything and that's it. And there's no growth that's happening there. So what are you looking for in a competent mental health provider? Well, maybe we should go into what you need to walk away from if you see this first. You never want a healthcare provider who is not looking like the role. One of my past clients told me about a therapist that she was sitting in front of who was busting out of her clothes. If they can't even look professional enough and have it together enough to be in the role, maybe that's an indicator that they have some stuff that's out of line in their lives. They need to be role models, people. Number 2, they're telling you what you're thinking and feeling. Let me tell you right here, right now. No one knows what you're thinking and no one knows what you're feeling. They have no right to tell you these things. Are they freaking psychics? They're in the wrong business. So, what you're looking for is somebody who will say to you something like, I'm wondering if I'm understanding you correctly. Is this what you mean when you say XYZ? That's called checking in to make sure that the provider is understanding what their client is saying in the correct context. Super important. Another thing that I learned from my non-linguistic programming, I used to give a lot of directives. You have to do blah, blah, blah. No, that doesn't work for people because you know what? People don't want to be directed in what they do. Look at a 2-year-old. Give them choices. 2 choices. And they'll have a lot better movement with them because everyone wants to be in control of themselves. It's called creating an identity. So instead, it's saying, I have a couple of suggestions I think you may find helpful if you use them. Here are what they are. And then you go through and you explain to them what the suggestions are and how they go about using them, and when it's important to use them. These are much more important. Another thing that I have found people complain about is that their mental health providers will just sit there and listen to them. They don't give them any guidance. They don't give them any feedback. They just listen. Listening's great, but if they're not willing to give you any input, help you reframe things in a way that are healthier for you, they're not helping you. They're just keeping you stuck where you're at, and it's really frustrating. I had a therapist like this when I went to college. I could stare out the window for the entire session, say nothing, and he never had a prompt for me, any way to get me into saying what I needed to say. And because the stuff I had to say was really, really difficult. The therapist's job is to get you to open up. And it may just start with just asking, how's your day going? What do you eat this morning for breakfast? It doesn't matter. Just get them talking, and then you can ease into the subject matter of the day. Another problem is that you have a lot of therapists out there who have not healed their own problems, and they get triggered when their clients come in with the same problem. This is a real issue in mental health, so far as I'm concerned. If you still have triggers from your past experiences, you need to be in therapy. You can come see a hypnotist like me and I'll get rid of them really quickly. I can promise you that. So you can work with your patients and not be triggered by them, because no patient wants to trigger their therapist to have a meltdown with them. And they don't want you sitting there saying that you're right when you're not right. And I'll give you an example of this. I had a client who came to me a few years ago. She was a blackout drunk. Didn't remember what she was doing. Her two twin sons, 16 years old at the time, were yelling into the call, telling me that they didn't like her, didn't want to be around her, that she was a liar, they couldn't rely on her, she'd black out, didn't remember all the horrible things she said and did, and wanted nothing to do with her. And she was blaming the husband for all her problems. Now, the husband did have some issues, but her drinking was her problem. It's up to her to deal with it and then maybe bring some, shall we say, humility to the issue and some sanity back into their household. You can't take one patient's idea of what's happening in a household, especially when they're blaming their spouse. You need to talk to both of them and get a bigger picture of what's going on. If that's not happening, trust me, you as the patient are not going to get to have the healing that you need to have done. It turned out that this particular woman with blackout drinking did go to a treatment program. It worked for a little while, and then she got back to her drinking, and things went downhill from there. It's sad, but that's what happens. People have to be ready for the help before they will actually be able to move on from their problems, because there's a purpose to their drinking and the drug addiction and anything else that people are doing that's self-harming, and that has to do with not wanting to think about the negative thoughts they have. So these are the ways that they have to not deal with those negative thoughts, which are based on trauma, usually early in life, but not always. Sometimes it could be trauma due to partnerships that didn't work out well. Business partnerships, relationship partnerships, whatever. Another thing would be when a therapist believes they know everything there is about you without knowing you at all. They need to take a real detailed personal history to get to understand who you are, what it's been like for you in your life, the different things that you've been through, so they can help you to go through it and heal from it. You can't do that just with, go in and answering some questions and having them not remember where they left off with you in the last session. So you start all over again, starting with, what do you want to talk about today? No, they need to have a treatment plan. They have to have continuity of treatment going from one thing to the next. I was really lucky, actually, when I was getting help from my psychologist. She was really excellent, actually, many, many moons ago. And she did seem to have some kind of treatment plan because we always had things to work on. And she helped me heal a lot of stuff. It didn't take care of the bipolar that I had at the time, which was known as manic depression. Tad James helped me release that with timeline therapy, something he developed in 5 minutes, 14 years of treatment. Yes, I know. So realities and practicalities. But at least she was able to help me to understand my responsibilities and where other people had responsibilities, how to forgive those people for putting me into a situation that maybe I didn't belong in, etc. That is what therapy is about, people. It's about doing the freaking work. It's not about, oh, poor you, I'm so sorry you went through this stuff, blah, blah, blah. That doesn't help you grow. It doesn't help you with anything. So I hope you found this helpful, because I want the therapists out there to understand that they don't have a right to work with anybody until they have no triggers based on anything that any of their patients or anyone else in their life will say to them. I have clients who've told me the most horrific of things in their lives. I empathize with them, but I don't take on their problems as my own. They're their problems. My job is to help them overcome their problems. That means leaving a space for them to heal. I hope you're understanding what I'm saying here and some of the problems that we have out there in the world of mental health and why it doesn't work for so many people. Because there's realities that we need to confront. And please don't sit here and tell me, oh, I'm working on it. I was talking to a woman who said, I've been working on it for years. And we got together in a one-on-one, and she was telling me, well, it's an ongoing process. Yeah, it is an ongoing process. But if you're telling me that you're having this problem and you want to hire me to help you overcome the problem, well, working on the problem obviously hasn't helped you. So why don't you just invest to get it taken care of instead of playing games? As she did. These things are ridiculous. You have to be really clear that you want to be healed. You want to find a person who's willing to push you to do that really tough healing work. And by the way, when you're doing in hypnosis, you're in an altered state. Guess what that means? That means that even if you have what we call an abreaction, or you're feeling sad or angry, when you come out of the hypnotic trance state and come back to normal consciousness, you feel lighter and brighter because you did the healing work and there's no negativity. Whereas too many times, another problem a lot of people raise is that a person is going to have a negative reaction to something the therapist said or something that was brought up, and the therapist goes and looks at their watch or their clock and say, oh, we have to end in 5 minutes because they have another client coming in and they have to write the notes up on your case if they weren't busy writing up their notes during the case, which if they're doing that, fire them right there. You don't want anyone doing that. You want them to be able to remember what you said and take the notes later. They need to have eye contact. They need to be present. They need to be able to know what they are doing with you to help you heal. If they're not doing that, they're probably not doing a very good job for you. Just saying. And their notes need to be copious notes. Now, they get into difficulties because of the HIPAA laws, and if they put all this stuff into the notes, it can be a problem if they have to go to court for some reason on your behalf, or someone takes you to court and they have to be a, what do you call it? They have to talk about your case. So they don't want to have all that stuff in your notes. But this is the problem. If they don't know what you said, they don't know where they need to pick up to work with you. So it's kind of a catch-22 situation, double bind. That's a problem. Most of all, you need to trust the person and feel comfortable saying the most difficult things you have to say in front of them. If you're unable to do that, this is not your person. And you will know that within the first 1 or 2 sessions. It doesn't take long. Rapport is something that's built very quickly because when you know someone, when you like someone, when you meet them, and you know when they give you a negative response. Follow your gut and you'll be fine. Okay, I hope you found this to be really helpful because it's about time people were able to find competent therapists to help them work. And again, if you're looking for really quick, effective change, I'll leave my information, including the pricing, in the description below. I do programs based on what a person needs, based on their detailed personal history, and then we know exactly what you need in order to heal. I have a 97% success rate because I actually have a treatment plan based on your detailed personal history with the objectives that you want to meet, which goes way beyond just healing the traumas, the negative emotions, limiting beliefs. It goes into a healthy relationship with yourself first, and then healthy relationships with the people around you. Getting rid of the people who are toxic in your life, really important if you want to do anything in this life, especially be happy and contented, never mind fulfilled. Be able to get in touch with work that's meaningful to you, and being able to get in touch with your hobbies and things that you enjoy doing and making all those things happen. That's what I help my clients do on a regular basis. All right. I want to thank you for spending your time with me. Till next time. Bye-bye.